Morning, everyone. Sorry to be a little late. A lot going on. Case counts spiked after Thanksgiving. Case counts spiked after Easter and spring break. We can't have the same thing happen after the May long weekend. That's why Dr. Roussin will be out later today to announce additional public health measures for the May long weekend to address gatherings as well as staying at home. Future's in our hands. There are things we can't control. Certainly we can't control the fact we have a population of 1.36 million people and we're concentrated in one major center, more than most provinces. We can't control the effectiveness of the vaccine. After first vaccine, it varies, but they're generally saying between 60 and 78% on first vaccine effectiveness, and second vaccines we know are higher, can go as high as 90 in some cases. Thanks to our researchers for developing these vaccines. But we don't really have a lot of control over that. They do, and thank goodness for their inventiveness and their research and for the manufacture and availability of those important vaccines. So if we can't control these things, how's the future in our hands? Well, it's in our hands because we can control certain things. We can control following the public health orders. The more we do that, the sooner we get our lives back. And we can control getting the first vaccine. The more we do that, the sooner we get our lives back. And we can control getting the second vaccine. The more we do that, the sooner we get our lives back. Manitoba has experienced peaks and valleys. Peaks and valleys through this COVID pandemic, more than most other provinces. More valleys for most of last year up till around Thanksgiving. We were doing well here as people. We were following the health orders and we were keeping COVID pretty well at bay. But then we had a disastrous last part of the year. But then, for the first few months of this year, up until recent weeks, we had some of the lowest numbers in Canada, lowest case numbers outside of the Atlantic bubble in Canada. And Manitobans deserve credit for that, as I've always given you credit for that. But those numbers are rising now. Part of the reason is that we're so close together here in Manitoba. Most of our cases now are variant related, and they're in the city of Winnipeg, where we are, more than any other province, living in proximity to one another. And we're social people, and we like to get together. And we've been suffering through this pandemic because we can't get together for a long time. But we need to suffer a little bit longer so we can turn this curve like we've done before. We've done it before, we need to do it again now. We need to follow the orders, we need to get vaccinated. And we need to get vaccinated twice. Next week, we'll be announcing a vaccination incentives program to encourage every Manitoban to get both their first and their second vaccine. Best way to get Manitoba through this pandemic, to shorten this third wave, is to get needles in arms as fast as we can. Our vaccine team's been working really, really hard to make that possible, and we're forming a Team Manitoba comprised of representatives from business associations, community groups, many others, to gather creative ideas for how we can effectively reach out and incent Manitobans to do the right thing and to get their vaccine. So we can get back to doing the things we love with the people that we miss. It's important to face facts, and these are the facts. Most, not all, but most of our patients in ICUs have not been vaccinated. Most, but not all, of our patients in hospitals have not been vaccinated. And most of the people across our province that are getting COVID have not been vaccinated. And sadly, too many have chosen to ignore the public health orders. And our health officials are telling us that they are very concerned that that number is increased as a percentage of cases. It could have been said last year, early in the COVID pandemic, that you had no choice it can't be said that you have no choice anymore. Going forward, Manitobans have a choice, and you have an important choice to make. I respect the fact that each of you has to make that choice. But I also know that we're all in this together, that you're not alone in your decision and the consequences of it. I want to say quite frankly that I don't think that it's helpful to talk about herd immunity. I don't think that it's that helpful to say it's achieved at a certain number, a certain percentage. I don't think that's helpful. They used to talk, and some still talk, about herd immunity at 75%. What that means for Manitoba is that we still have 400,000 people that don't have protection against COVID, even at that number. That's not safety. That's not protecting everyone as best we can. I think we have to aim higher. I think we must aim higher. The higher percentages of vaccinations we can achieve, the sooner we can get through this third wave. The higher percentages of vaccinations that we can achieve, the less likely that there would be a fourth wave, or a fifth wave, or a sixth wave. We're all tired of the yo-yo, of the rebound effect. We like our valleys. We live in the Red River Valley, many of us. We like our valleys a lot better than we like our peaks. There is a three-step plan to success here. 1, follow the public health orders. 2, get vaccinated for the first time. 3, get vaccinated for the second time too. If you've got a vaccine already, if you've been vaccinated already, I just want to say thank you to you for taking the time to do that. It's important to do that. Please plan for the second one. Tomorrow is a really big day in Manitoba. Tomorrow is the day that we can begin booking second vaccines. And that's exciting. It's exciting because it increases the likelihood that you're safe and protected against the effects of COVID. It doesn't guarantee it. And remember, you're not safe just when you get the vaccine either, because it takes a little while to work. But remember that it's important to get that second vaccine to raise the likelihood of you being protected. Those percentages go up when you do that. If you haven't chosen to get a vaccine yet, these words are for you. I respect your right to choose. Your body is your body. Your decision is your decision. But you're not alone in the impacts of that decision. So consider that. COVID is evil. It robs your breath. It robs your strength. It robs your freedoms. It can take your life. There are real consequences to getting COVID, and I don't want those consequences to happen to you. So, I met a man a couple of weeks ago at the grocery store in my hometown, and through his mask, he said, I didn't believe in COVID. I didn't take it seriously. And then I got it. And then I gave it to my daughter. So, I didn't care before, but I care now. Tell everyone to get a vaccine, he told me. I said I would. I keep my promises, and I am. Get vaccinated. Get vaccinated for your own reasons. Please get vaccinated. You know, we have super sites, we have pop-up clinics, we have 140 doctors and pharmacists ready to serve your needs. We have a location close to you, and more coming all the time. So, please, get vaccinated. Do it for your own reasons. Do it so you can see family and friends. Do it so you can have dinner and a movie. Do it so you can go to church. Do it so you can travel. Do it so you can help out a friend that's trying to survive in a small business or wants to get started again. Do it to help your child get back to school. Do it so you can never give it to anyone else. This is important. Please get a vaccine. Do it for your own reasons, but do it for others as well. Happy to take your questions.
Thank you, Mr. Premier. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this morning, from the Winnipeg Sun, Josh.
Good morning, Premier. Josh Aldridge, Winnipeg Sun. You're talking about more restrictions coming this afternoon. What more can be taken away? And if the people who are not abiding by health orders as it is are causing some of the issues, what hope is there that they actually follow these health orders and they don't just further punish those who are currently following health orders and physically distancing and all the rest?
Yeah, it's a good question, Josh. I wouldn't use the phrase taken away so much, and that's true in the short term, but what these health orders do is give us back our lives. And so I would say there are some measures that Dr. Roussin they are now ironing out the details of, and he'll be sharing with Manitobans in the not too distant future. And they're important measures so that we can give each other our freedoms back.
Okay. Looking at the news yesterday, 3 people flown to Thunder Bay to relieve stress on their ICUs. Are there going to be more flown out there in the coming days? And what measures have been taken specifically to address this increase in ICU capacity since Tuesday night? And what is our current ICU level at?
I don't have the current numbers in front of me, Josh. I can tell you that numerous measures have been taken prior to the COVID pandemic to strengthen our ICU capacity, and that those measures have continued to be taken, obviously accelerated as a consequence of the pandemic. And I can also say thank you to Northwest Ontario for a long-standing partnership. Look, we have offered healthcare services to Northwestern Ontario residents for many, many years now, and this is a reciprocal benefit of that good service.
From CBC Radio Canada, Julian.
Good morning, Mr. Premier. I got another question regarding the patient transferred in Northern Ontario. I'm wondering if we are planning to get more help from other provinces since we are lacking some staff and ICU beds.
Well, I would say that nothing's off the table in respect of getting additional help. Look, this is how the Canadian Federation works. This is how a family works. We offer assistance when it's needed. As recently as a month ago, we offered some small assistance to Ontario in their time of need in terms of additional supplies, ventilators, PPE, invited retired nurses to consider the possibility of going and helping, and reciprocal supports in a time of need for Manitoba are appreciated, and that's how Canada operates.
Thank you. You also mentioned that some people are not getting vaccinated and that there is many hospital patients that are not vaccinated. Do you have a strategy to address this hesitancy?
Yes, we're going to announce a cooperative, it's been in development for a while, but we're going to announce a cooperative and ambitious strategy to encourage vaccinations next week. It is necessary, I think, and it's something that has been undertaken elsewhere. We've got examples of other programs. We know some things that have worked in other areas. They may work in Manitoba as well. But we need to incentivize the right kinds of behaviors, and this is an important aspect of where we need to go to push our number up, to get more people, a higher percentage of people vaccinated. The higher percentage, the better, because more people then will be safe, and this allows us then to reduce restrictions further as we bend our curve down on hospitalizations and case numbers. We'll be able to then start loosening restrictions at the appropriate time and in the appropriate way to start getting those freedoms back that we're all anxious to get back.
Thank you.
From CBC Manitoba, Bart.
Mr. Premier, will you be asking Ottawa or the military for help with field hospitals or staffing hospitals? And if not, why not?
Well, Bartley, thank you for asking that. I think we should be open to asking for help where needed. I think our public health experts will certainly direct us if they feel that's an appropriate course of action to take, and we'll certainly follow the lead of our public health experts in respect of those things. And I would think also, you know, we've had here in Manitoba a real benefit by having, for example, the military come in to some of our northern communities. Each of you who are journalists have reported very well on that. That help was very appropriate at the time, and when it was needed, it was delivered, and I thank Ottawa for that.
Thank you for that. Right now, there is no room at ICUs for additional patients, as you saw with by the necessitation, to transfer 3 over. We are expecting, based on the modeling, dozens more in the coming weeks, especially as the case counts remain high. There also is no triage protocol, despite the ethical framework that calls for a triage process. What will ICUs, how are they expected to manage right now where we are at this record number? They can't handle more critically ill COVID patients, and they don't even have these triage protocols.
Well, I can only say that I heard some of the comments from Lynette Siragusa yesterday. I've asked questions of our health leadership, numerous questions in respect to most aspects of this pandemic, if not all, and they've assured me that they have a plan. I think we're in the darkest days of this time with this pandemic. Clearly, the case numbers are very, very high and unsustainably high. And I think it's important to understand that we are availing ourselves of every tactic and technique we can possibly use, given the limitations of the resources that are always a real factor in every jurisdiction at all times, but are especially evident at this point in time. So, as far as additional help and support is concerned, we're availing ourselves of the Northwest Ontario capacity. I understand there's quite a bit more capacity there as well. And I would emphasize in respect of that this is a long-standing arrangement where generally we have been the ones providing the care to that area. I'm told that at any given time, over the last number of years, we've had about 20,000 patient visits in Manitoba per year from Northwestern Ontario. So we've been offering support and help to them, and now we're availing ourselves of support and help from them. Clearly, if needs grow beyond that capacity, then we'll look for other help. And I understand the health leadership is doing that preparatory work, or has done it already.
From the Canadian Press, Steve.
Good morning, Premier. It seems to me that having people who require intensive care travel 600 kilometers to find a bed and staff that are available to treat them is a sign of a very, very deep crisis, and something that should be avoided at all costs. So what are you doing now to ensure that this is not going to continue? And have you an arrangement with Thunder Bay up to a maximum of people that can be shipped there?
Steve, I can't tell you with accuracy the number of, I understand a couple of dozen, but don't hold me to that. I think the health leadership will be able to tell you the additional capacity, whether in Thunder Bay or in other facilities in Northwest Ontario. But there is the ability to move appropriate, stabilized patients in ICU, and that I think is the priority. I'm not a medical guy, I don't pretend to be, but I do have a lot of faith in our medical leadership in these times, and I continue to place my faith with them.
And there are plans for more rallies and protests against the public health orders. In the past, we've seen tickets given out, a few at the event, mostly afterwards. It doesn't seem to be affecting behavior as much. Are you looking at getting a court injunction or taking some proactive measures to stop the rallies from starting before they begin this coming weekend? I
haven't had discussion on injunctions. I have had discussion on enforcement. I have communicated very, very clearly, though I, of course, cannot tell anyone in the justice system, nor should I be able to go and ticket someone. I have made it very, very clear as I can, that I expect real consequences and real deterrence as a result of our health orders. We've communicated also to the Winnipeg Police, who are the principal agency that we're counting on, of course, to enforce measures within the city where the problem has escalated most severely. That we encourage them, of course, to make those deterrents real, and we'll continue to do that. So it's clear that we are doing our very best to have enforcement measures and to have them enforced. That's clear, according to the Canadian Association of Civil Liberties and people who've taken court actions against our province. The fact of the matter is, I would argue that in the absence of such deterrence, the situation might be worse, Steve, than it is.
From CTV Winnipeg, Mike.
Hi, Mr. Premier. I also have a question just about anti-lockdown or anti-restriction rallies. There's one planned for May 28th at the Forks involving the same speakers that caused the closure of the Forks not too long ago. I'm wondering, what would you say to the small businesses there that are worried that the same thing will occur, that they'll lose more funds and money due to a forced lockdown because of this rally? What would you say to them to take away any fears that we're going to see a repeat situation?
Well, I'd say to them that I'm deeply disappointed that they're suffering as a consequence of this pandemic, and I certainly would hope that additional enforcement measures will be applied to this idiot who wants to continually go around and encourage people to be idiots with him.
Okay, thanks for that, Mr. Premier. I also, you obviously are talking about today, just that there is vaccine hesitancy among the Manitoba population. I'm wondering what you're hearing as to the reason why some people don't want to get vaccinated, and what areas is that sentiment most prevalent?
Well, I know that there have been studies done on rationale for vaccine hesitancy, and there are people who feel that the vaccines are new and so not proven yet, and so they're hesitant for that reason. There are other people who feel that they don't like to have a foreign substance introduced into their bodies too. I think that we have to make the case as to the importance and urgency of getting a vaccine, and we have to make people feel more comfortable and confident that that is the right thing to do for them and for their family, friends, for all of us. And so we have to accept that challenge. I talked to Doug Burgum the other day on another issue, and we were talking about how quickly in his state it went from lineups to get vaccines to needing to persuade people to get a vaccine. It just happens fairly quickly. I think we're perhaps a few weeks away from that, but nonetheless, the time is now to start encouraging people to sign up. Starting tomorrow, we begin the sequence of second vaccinations for many, but we still have too many folks who haven't got their first. So we need to get on it, and we need to encourage everybody to get vaccinated as soon as possible so that we can get our lives back and so we can shorten this third wave here in Manitoba.
From City News, Stephanie.
Hi, Mr. Premier. Stephanie Lasuk from City News. We know that the nurse-to-patient ratio in ICUs has gotten bigger with less nurses to serve each patient. When is the last time you've spoken to other premiers around us asking for help in any form, and what was the specific request made?
Haven't spoken to premiers about a specific help ask. Many of the other provinces are in not as is currently the situation in Manitoba, but have been or continue to be in various stages of high demand for services. And so last conversation with premiers, I think, was about 10 days ago. At that point in time, we were in a rising situation, but Alberta, Nova Scotia, it could be argued Ontario, Saskatchewan were also in comparable or worse situations than us, so I wouldn't have asked them for help at that point. Now, we'll see. These options are on the table. we're looking to, and my health minister or others can give you more detail, but we're looking to have nurses move from other areas of lower demand and lower need to accommodate us, and we're working with the nurses union, I'm told, to allow nurses to move more to functional roles within our ICUs to assist in helping. And we'll continue to work on that. We've hired abundant additional nurses since we came to government, but obviously not abundant for a global pandemic.
Okay, why not make that call today for external help when it came for the PCHs? Some would say that it came too late, and transferring patients to Thunder Bay might suggest that we've already looked kind of through all the nooks and crannies here in Manitoba to pull help into those areas. So why not make that call today?
Well, we'll take the advice of our health experts on that and continue to. We have asked for assistance when we've needed it. We aren't averse to doing it again, but I'll take the leadership of our health experts and their advice.
From CHVN, Taylor.
Hello, Mr. Premier. Can you just clarify when the province asked for help from the military and other provinces?
We didn't ask for help from military. That was Indigenous communities to our north. I was just referencing that because I appreciated the help that was provided.
Yes, but earlier you mentioned that you were looking into the potential of asking the military for help.
I just said that we would consider options that might be, we won't rule out options that may be available to us to get assistance where needed.
Thanks. And why haven't we heard from our health minister in these COVID-19 press conferences?
You'll learn more about specific issues. You have heard from our health minister frequently, though, Taylor. She's been available for scrums on a regular basis. She is working her tail off, and so I'll have more information to give you on any question you like, but as far as availability of my ministers, they've been available throughout this pandemic.
From the Winnipeg Free Press, Carol.
Good morning, Premier. We were told that you missed question period yesterday to get a first-hand look at the wildfire situation west of Winnipeg, but couldn't you have been briefed on the wildfires, knowing that it was going to be such a bad day for Manitobans finding out the ICU patients had to be sent out of province?
You're talking about wildfires that have caused already 700 or 800 people to be evacuated from their communities and homes. You're talking about a situation where not just property but people are placed in danger, where their health is at risk. I felt it was appropriate to show our support for these folks, and I'll continue to do that where appropriate.
And you and your public health officials have assured Manitobans, or had assured Manitobans, that adequate restrictions have been put in place and that the ICU situation was under control. But with all of our critical care beds full, what happens if there's another surge in ICU admissions or a major highway accident this long weekend and patients can't be moved? Can our hospitals handle it? What's the plan?
Well, we're in a global pandemic, Carol. There isn't past experience to guide us, and so we place our faith and confidence in our epidemiological experts, our senior health officials, those who are doing their absolute best in an unmapped roadway to try to map a course. And so we'll continue to do that and adapt as best we can as we go. Really, the only people who have all the answers are columnists. And we place our faith instead in senior health experts with 10 years of training and medical experience that goes beyond that from their formal training into 20, 30 years of practical experience. That's who we're going to take advice from.
From Global News, Anya.
Hello, Mr. Premier. What do you say to Manitobans worried there won't be an ICU bed if they need it, or that they now risk being sent to a different province away from their family?
I would say to them that we're doing our absolute best in an unprecedented time to provide the services that we can provide to all people who need them, and our greatest concern is for those most vulnerable in our province. We've taken every step throughout this pandemic to prepare. We introduced more severe restrictions than other provinces. We introduced better enforcement than other provinces of those restrictions. We have introduced very, very strenuous public health orders, not at a peak, not waiting for a peak, but in anticipation of an increased need for those orders. We now continue to count on people to do two things. One, follow the public health orders. Two, get vaccinated. We do that. We delayed this wave. Now we can shorten this wave. That's what Manitobans have in their hands.
Okay, thank you for that. And do you and your government take any responsibility in us getting to this point? And if so, in what way?
I take all the responsibility. It is totally my responsibility. Everything that goes wrong is my responsibility. Everything that goes right is Manitobans.
From the Brandon Sun, Colin.
Morning, Premier. The current situation is almost certainly putting our healthcare workers under great pressure. Is there anything the province can do to recruit additional workers or help out healthcare workers during this difficult time?
Well, we continue to appreciate and thank, I think all Manitobans do, the tremendous work of our frontline workers in healthcare. I'm not excluding, I hope, the folks who keep the building going and, beyond the frontline nurses, the people who are involved at every step of the way on providing our healthcare services, but we could go broader than that. There's been tremendous stress on our teaching community, on the folks who run our schools as well. Tremendous stress on our parents as they have to manage with school closures, for example, and home learning is a challenge. Tremendous stress on our child care system, tremendous stress on people who run small businesses, tremendous stress on people who work in small businesses or who aren't able to work because they're out of a job right now. The stress is spread around really, really well during a global pandemic. That's why we've invested more heavily as a government before this pandemic in mental health services, why we've really focused on improving the counseling availability so folks can have actual supports given to them online, for example, or through human contact with counseling. That is a service that we introduced early on and we continue to expand upon. And I think all of us are very, very concerned about mental health issues now, and it's good that we are concerned about mental health issues now. Perhaps that was something that wasn't in the attention span of some people before this pandemic. I think it's there now. And I'm glad that we've taken the actions we have, and we're perfectly willing to take more actions that are necessary.
With resources being allocated to COVID hotspots, is there any risk of facilities in rural Manitoba being closed or reducing their hours of service because of the situation?
I don't know of any specific facility that would fit that category, so I would doubt it, Colin.
Our final reporter this afternoon, Mr. Premier, from CJOB, Schuyler.
Hi, Premier Pallister. Thanks for your time this morning. At certain points over the last few weeks or months, you, Dr. Roussin, and Dr. Atwell have promised Manitobans that we wouldn't go down this path. And while we did delay a third wave, certainly we're still in it right now. I'm just wondering how you think we ended up here.
I've never promised Manitobans we wouldn't go down this path, Schuyler. Let's be clear. I said to Manitobans numerous times, the future's in your hands. And I've also said, quite clearly, play defense. And I've said that probably at every press conference since you started covering these pandemic stories. So what is real about COVID is its newness to us. What's real about the variants that we're facing is their newness to us. COVID adapts. It is very adaptable. It's a vile, unforgiving entity that does not fail to adapt. We have to adapt with it. And so as people, we have to do what we can do to protect ourselves and others from COVID. And if we let our guard down, then the problem gets worse, and too many have. And the reality is, These restrictions we've introduced, as you well know, earlier than most, more severe than most, don't work unless people work at them. And so we're doing our absolute best as a government to provide the resources to treat the consequences of COVID, to anticipate them and try to prevent them from being necessary. But what we face now isn't a could have, should have, might be situation. I'm here today to talk about what is and what needs to be. I'm talking about our future, which we have in our hands. We need tougher restrictions, but we need people to be tough about following them too, because COVID is vicious and we need to be adaptable to beat it. We don't have enough people vaccinated, and so the most important challenge, I think, right now is to encourage people to get vaccinated, to get them out there, to give them an opportunity to do that, and then to do it a second time, because as you know, that'll really bolster the protections of the people of Manitoba. So that's the campaign I'm announcing today. The restrictions are for this weekend. Dr. Roussin will be out in a couple hours to tell you more. Thanks, everybody.